to Knee TV. I'm Dr. Adam Rosen. I'm an orthopedic surgeon who specializes in knee replacements. So today what I'm going to talk to you about is what I feel is the simplest and easiest exercise that you can use to strengthen your leg. One of the most common things that I hear about from patients regarding knee pain is that they have a sense of weakness or instability or giving way in their leg. And one of the simplest ways to improve your knee, whether or not you have a normal knee or an arthritic knee or a replaced knee, is to strengthen the quadriceps muscle, which is the uppermost muscle on your thigh bone. If you rub your leg right now, it's that area of the muscle between your knee and your hip. And that's an important muscle that you'll use to get up out of a chair, go up and down the stairs, and get off of the toilet. And as that muscle gets weaker, it tends to give those senses of pain or instability to the knee. So this next exercise that I'm going to show you is probably the simplest exercise to do. And one of the reasons I think a lot of patients actually avoid doing it because they almost expect it to be harder or more difficult. And the nice thing about this exercise, it requires nothing other than you and your leg and a flat surface, such as the floor, or if you have difficulty getting on and off the floor, you can do this in your bed. So what I recommend to patients is to start a 6 to 12 week exercise program. And what that 6-week program would be is to start with 10 exercises on the right leg and 10 on the left. So we call these repetitions, or how many times your leg comes up and down. And I ask that my patients do this on Monday, Wednesday, Friday, and try to do this first thing in the morning so you don't have an excuse later in the day to avoid it. 10 should be easy. The second week, what I'd like you to do is 20, Monday, Wednesday, Friday. The third week, 30, and on, up till you get to the 6th week. And on the 6th week, you should be able to do 60 on both the right and the left leg. Now, if one leg is the weaker of the two, or the more painful of the two, what you'll start to notice around the 3rd or 4th week is how much harder it is to do on that one side, and how much easier it is to do on the good side. So that's why it's important to do both legs. And if it is more difficult once you get up to the higher numbers, say 60 repetitions, it would not be a bad idea to do 30 and 30, and then come back again and do 30 and 30 a minute or so later. Now, for those people that can do that easy, what I find is for the second phase is to add a weight. This might be adding a hiking boot or a ski boot or a snowboard boot. Or if you have an ankle weight, start with a 1 or 2 pound ankle weight. And what you'll do is the same process Monday, Wednesday, Friday. You'll start with 10 repetitions on the right leg, 10 on the left, and build that up 10 repetitions every week until you get up to the 60 repetition mark. And if you really enjoy this, what you can then alternate with is a aerobic exercise program, such as a stationary bike or a walking exercise that you can add in on Tuesday, Thursday, and Saturday. And this becomes a great way to get back into an exercise program and to strengthen your quadriceps muscle, which would strengthen your leg and potentially decrease the pain in your knee. Okay, so here we are. This is all you need, you and a flat surface. What's very helpful is if you bend your opposite leg, this can take the strain off of your low back. The next step you want to do is set your leg up for the exercise. So this starts with 2 steps. One is bring your toes and ankles up. So you want to lock your leg into place. The second phase is taking your knee and pushing it down so you engage your muscle. The third phase is to start the exercise. So you're going to lift up, usually about 12 inches. Come down about 10 so your heel does not touch. Up, that becomes 2, 3, 4, 5, 6, 7, 8, 9, 10. Once you've completed 10 on the right leg, bend that leg, straighten your left leg out, and the same phase. Bring your toes and ankles up, lock the knee so your leg becomes engaged, and lift up again. Now for a variation, you can lift it and hold it for a count of 10 instead of coming up and down. Do not raise your leg up super high. At that point, you're not engaging your quad muscle. And if you find 10 difficult, start with 5. So there you have it. The simplest exercise that you can do to strengthen your leg, which will potentially decrease your knee pain. This is something that you can start this week. Start by doing 10 repetitions Monday, Wednesday, Friday, increasing 10 repetitions per week up to a total of 60. And if you do find that to be easy and not challenging, start back over again at 10 by adding an ankle weight. Hopefully this helps you and helps your knee pain. Thanks for watching Knee TV. I'm Dr. Adam Rosen.